We're thinking about how to support people in our communities, as well as how to support each other and ourselves. And we're very blessed to have some very knowledgeable speakers with us here this evening, who are either working directly in the mission field, or in the case of one, is looking at the picture across the local authority, a wider picture. Obviously, mental health is an enormous subject and it covers a multitude of possibilities. And tonight, one of the speakers said to me, tonight is going to be a bit like opening a huge book and seeing lots of chapters. And what we're aiming to do is to give you a summary of some of those chapters. But obviously, there will be plenty of room for more Zoominars like this, looking at some of those subjects in much greater detail. All of us are really mindful of all of our well-being tonight, and there is going to be a 5-minute break at 6 o'clock when you can all dash off and have a stretch, or make a cup of tea, or go to the loo, or whatever you want to do. But as we go through the Zoominar, if you're feeling like you need a break, if it's getting too much, please don't force yourself to sit there. If you need a break, do take one. You can switch off your camera if you want to, and just go off. We are recording, and we will be sending the recording out to all of you in the notes. So we're going to start tonight by hearing from Bishop Simon, and he's going to talk into a question that I'm often asked in my role in social community engagement, social action, and that is, why should the church be involved in this? So thank you very much, Bishop Simon.
Thanks, Caroline. Good evening to everybody. Mental health is heading up the political agenda and has been for several years. That's partly because there's been a notable and worrying increase in mental illness among young people in the last decade, but also because adults are more willing to talk about what's going on inside their heads. There's less censure and more understanding, but we still have some way to go. We know the pandemic and subsequent lockdown have made an impact, pushing some over an edge they were already near, inducing distress in others for the first time. And it may be helpful to make a distinction here. We're being encouraged by campaigns to talk more openly about our feelings. Mental wellness is important for all of us, but we shouldn't equate dips in mood with the full frontal assault of mental illness. Some of us would feel better if we had more awareness of what's going on in our minds and where the trigger points are. But if you're suffering from a diagnosable mental illness that is not being treated, the likelihood is you are living a nightmare that can barely be described to others. As if you've been thrown into a darkened, locked room and just left there. Mental illness does not respect the Geneva Convention. It's like torture for those who are in its grip. Those of us who use the Bible to tell stories and convey truth will know that its writers did not make much of what was going on inside people's heads. It just wasn't the ancient world's house style. So we have to use our imagination. However, the book of Psalms is a psychiatrist's couch full of testimony about feelings, full of people who sense that they're drowning and that God, in the words of the Phil Collins song, is not lending a hand. St. Paul himself said at one point, "We were so utterly, unbearably crushed that we despaired of life itself." Those are not the words of someone living a victorious cycle of pray, convert, repeat, . And we should put them alongside his promises about God's capacity to deliver us from destructive feelings, because both have a part in our faith. I'm so pleased that this webinar is taking place tonight. We need to understand as much as we can about mental illness, what it looks like and what it does to people. We need to be aware of and thankful for the expertise of the many agencies that seek to support those with mental illness, some of whom we'll hear from tonight, because this will enable the churches to make spiritually wise, pastorally sensitive, and practically smart responses to the communities they are part of, where far too many people live lives of quiet or unquiet despair. Thank you.
Thank you very much indeed, Bishop Simon. Food for thought. Okay, so we're now going to, I'd like to introduce you to Martin Yates. I've known Martin for many years, I think since 2007, and I've worked with him. He is a psychiatric and general nurse with 40 years of experience in the NHS, and he's a specialist in neurodevelopmental paediatrics. Thank you, Martin. Welcome.
Thank you very much. It's very nice to have the opportunity to talk to everyone this evening. When Caroline first contacted me to ask me to be a part of this conference, I was wondering how I was going to address the brief that she gave me, which is basically how the pandemic caused by COVID-19 is affecting community health, including recognizing mental health problems. Part of the problem is that although I have been in the NHS for 40 years, as Caroline said, the current pandemic is unprecedented. I've never known something like this before. However, when I was thinking about it, I did realize that I have been involved in comparable traumatic experiences, although on a much smaller scale than the current pandemic. And the first one that came to mind was when the Falklands War was taking place back in, I think it was 1982. At that time, I was working in an adult psychiatric hospital, and we had a very mixed group of patients that I was looking after at that time. Many of them had been in the armed forces during the Second World War, not just from the UK. I remember there were Polish patients there, and also some patients from the Far East who'd been involved in various aspects of the war. And all of them had been in hospital pretty much since the war finished, or they came back having been recognized as unfit for service anymore. The Polish soldiers largely didn't speak. There were 4 of them, and they were all mute. And they were very, very nice, gentle people, I remember, but they didn't speak. And when they saw footage of the Falklands conflict, they became unrecognizably distressed for many, many days, to the point where I remember we didn't put the television news on because it was causing them such upset. Symptoms that I won't go into now, but certainly they were very different to how they had previously presented, and I think that's the valid point from this. The second experience that I recall was I was working in central London in one of the major teaching hospitals on an accident and emergency department when the Brixton riots were taking place. Again, I think this was the mid-80s. And what I remember at the time, going out from the hospital to do some general community work, was the sense of trauma that the area was experiencing. People that I'd been used to treating and used to seeing were actually very reluctant to even open their doors. Some had not been out for many days. Other people were clearly experiencing mental health problems. What I mean by that is they were low in mood. Some had become uncharacteristically volatile. Some people were not eating. Some people were eating too much. And they were also running the risk of substance abuse, perhaps the use of drugs, I remember on a number of occasions, but also alcohol as well. All as means to try and manage what had been, certainly in that area of South London, a very traumatic event. Thinking about linking that with the pandemic, I think there's a very strong link between what has been undeniably an extremely traumatic experience for the entire country. And the symptoms that I've just described in both those previous instances, I have personally seen myself since it's been with us since March. Mainly with young people who I work with now, but with their parents as well. And I think that's one of the factors that often gets overlooked when we deal with young people. It can be tempting to just work with the individual rather than with the whole system. And I think that's a point maybe to be debated later in the seminar, because it's not just about an individual, it's about the system that they're working in. A bit like the ward that I was working on during the Falklands War, it wasn't just about the four guys from, who'd become uncharacteristically distressed. They had an impact on everybody else on the ward as well. And it wasn't just about the people in Brixton in South London. There were other traumatic events going on across the country there too. So it is very much about a systemic approach rather than just a micro approach to dealing with multiple traumas. I have certainly seen the impact of the pandemic on people. We used to run groups for people. We've been trying to offer those online, and they haven't been terribly well attended. I think that's partly because people have been used to shutdown. And I think, for later debate, maybe the whole point of what we do next is about trying to open things up again from what has been an extremely closed shop. That was our challenge on the ward many years ago, was to try and help individuals who didn't speak anyway to find a voice. And also for the community of South London, where I was working, to likewise find a voice to firstly express their dismay, their distress, their discomfort, their unhappiness, their anger about the things that had taken place for them, but also then to try and find a road back to resolution and to rediscover their lives and move forward accordingly. I think a lot of people are talking about getting back to normal. I don't know quite what normal will be, but I think maybe the challenge isn't about getting back to normal. It's about finding a sense, if you like, of normality, which I think is different. And I'm looking at Caroline and I'm thinking my 10 minutes is almost up. So I will stop there. I'm tempted to go on, but I think I'll find myself running over time. So I will stop there, and I thank you very much for listening to me.
Thank you very much indeed, Martin. Okay, so I'm not going to comment about what our speakers are saying, because I think that's going to come up in our discussion time later on. So I'm now going to hand over to Suzanne. Suzanne Westhead is the Associate Director of Adult Services for Medway Council. Thank you, Suzanne. Oh, now, have we lost Suzanne? I'm not seeing Suzanne. Keith, can you see Suzanne? No, we can't see. We've lost Suzanne temporarily. So I will sort out where Suzanne has gone, or maybe Keith can do that for me. So I think what we'll do, if that's all right with you, Laura, can we go and talk to Laura now? So Laura is, well, when we were talking earlier on, Laura listed about 9 different things that she does, but she works for Mind in Bexley. And Laura, I'm going to leave you to talk about what you do there. Thank you.
Yeah, no problem. Hello everyone, thank you for coming onto the call tonight. It's fantastic to see so many people here that are interested in mental health and how we can support people. It's so lovely to see. So firstly, yes, I'm kind of a jack of all trades in mind. I kind of offer lots of different things. So just quickly, I fundraise, I do talks around the community about emotional well-being and mental health in general. I provide training for people, and recently, because of COVID, my role has really changed. I have recently set up 2 helplines, one in Bexley and one in East Kent. And the reason was we recognised that because of COVID, we need to make sure that we are reaching people even more than we already are. So we set up 2 helplines to ensure that we was reaching out and we was supporting people. And since then, lots of people have come forward. I think when I last did I looked statistically, we'd helped over 200 people on the Bexley line, which is fantastic. And in terms of kind of what we were saying about COVID, I think we've been seeing a lot of uncertainty, as you can imagine, a lot of anxiety, a lot of low mood around, jobs and the way things are at the moment and how difficult lockdown has been for a lot of people. But now what we're seeing a lot of is kind of moving out of lockdown and how people feel about that. We've kind of been in a bit of a bubble, and then we're expected to jump back into work and different things, and that feels overwhelming for a lot of people. I realised I wasn't even meant to talk about that, but I just thought that was important to share. So quickly, in terms of the work that we do at Mind and Bexley, as I said, we've got our counselling service, which is our IAP service. So this is where we offer support to those who are 18 and over, registered with a Bexley GP, and who are struggling with low mood or anxiety, basically low mood or worrying a lot. And to be honest, I would say that's a lot of us. I'd say a lot of us have life problems that mean that sometimes we don't want to get out of bed in the morning. It might prevent us going to work, or we might just be really struggling with something going on in our life. So we do that. Currently, we're offering that via the telephone, via Zoom, and we do online therapy as well. And I think online therapy is great because there are people that don't want to see a therapist. They aren't at that stage where they want to speak face to face about what's going on for them. So online therapy, I think, is a great start because they're kind of getting lots of different coping strategies and learning how to manage on a day-to-day basis. So we've started that, and that's been responded to really well. So that's our counselling service, and that's something that individuals can self-refer into on our website, or you can go to your GP and get a referral. Next, we have our recovery college, and our recovery college has changed as well since COVID. We now do lots of courses and workshops via Zoom. So we do things like helping to manage with anxiety, understanding depression. We do kind of craft workshops online, a men's group, a women's group. We do things like relaxation techniques, kind of a whole portfolio really of wellbeing workshops. But not only that, kind of peer support sessions and activities, because we recognise it's not just about mental health and improving your well-being, it's also about getting out of isolation and not being alone. So that's why we started the groups. Hopefully I'm not going too fast, I'm just aware I haven't got much time and I've got so much to say. So that's the recovery college, but as I said, all of this will be on our website. I briefly touched on our wellbeing line. What I will do, I'll send lots of information and I'll ask Caroline to send it out to you. Our wellbeing line is open Monday to Friday, 9 AM to 5 PM. And that is basically there for anyone in Bexley who just wants to chat, who wants to talk about what's going on for them. I work on the line and we have lots and lots of people coming through to us who are just really struggling. They need support. I've even had somebody call who, this is quite random, but I had someone whose dog bit their partner. So I had to talk her through that and think about what we do from there. So that was something new. And I think what's good about that is people know that someone's there on the other end of the phone, especially where we're not in the offices. They need to know that they can call a number and there's people there for them. We also have something called our crisis CAF, and this is something that I would really, really like you to tell everybody about. So this is our drop-in service in our Mind and Bexley office. So basically this is open every single evening, and it's been open since COVID, pre-COVID, we've not closed. And what this is for anybody in Bexley who is struggling with their mental health. So if you know anyone, if you're talking to someone and you think, I don't know where they need to go, send them to our Mind and Bexley office, because we're open every single evening. So 6 PM to 10 PM, Monday to Sunday. How it works is they'll walk in, they'll sign in, and they'll have for however long they need to speak to somebody about what's going on for them. And the reason it was created was because we recognised that A&E was potentially not the best place for people who were struggling with their mental health, because they wouldn't get somebody to sit with them. They might be waiting for a long period of time, whereas at our service, they'd walk in, they'd get seen straight away, and they would have that space to be able to talk to somebody. What would then happen throughout the conversation is we would then kind of refer them into our services, or we would refer them into a service that is the most appropriate for them. As you can probably appreciate, excuse me, this is a service that's really needed, really, really needed. And I would say that this is the service that I'm exceptionally proud of, because I think this is the service that, would be the kind of last step for somebody who was really struggling. And just to know that it's there, I think it is a really good support system for people in Bexley. I've had lots of people come to me and say they don't want to do counselling, they're afraid, they're ashamed, different things like this. And I've said to them, you know what, I think it'd be great for you to go to the crisis cab, because this is a great step for you. This is a really good step to prepare you for the treatment that you need. And once they go there and they speak to, you know, the different members of the team, they feel quite reassured, and then they feel that they're empowered to then access that therapy. So that's something that I'd really love for you to kind of get out there as much as you can. We've got other services as well. We also support carers, which I'm very happy about, because I think that when you are struggling with a mental health problem, it is exceptionally difficult, but I think it's actually potentially more difficult when you are a family member or a friend or a neighbour looking after somebody and kind of dealing with that worry on your own. So we do actually support carers as well. So all of these services will be on our Mind and Bexley website, and you'll find all the information. Just click on services and you'll go from there. Caroline, have I still got time to talk, or I've gone over? You're on mute, Caroline. Oh, yeah, still on mute.
Sorry,
oh,
I beg your pardon, everybody. I do apologise. We're still trying to track down poor Suzanne. We don't quite know where she's disappeared to, so we will bring her back on.
Does that mean I can keep on talking?
No, but thank you, Laura, very much.
No problem. Thank you for having me.
Our next speaker is Dr. Reverend Ruth. No, she's not a doctor. I keep saying this wrong. It's Reverend Ruth Biabel. She's an NHS mental health care chaplain, and she's recently contributed to a book called Chaplaincy and Spiritual Care in Mental Health Settings. And she's going to introduce some of her findings about that, and about the importance of faith in helping support our mental health. Thank you, Ruth.
Thank you very much, Caroline. Thank you for you keep awarding me a doctorate, and that's very good. I'm very grateful for that. Yes, this book has some findings in it which perhaps you would find useful. My chapter is drawing on some things that I found when I did my MA in psychology of religion, and so it's very much looking at how religion can impact our mental health positively, but also looking at how it can sometimes function in a negative way. So today, actually, I'm focusing on faith as a resource. As a chaplain, I'm there for people of all faiths and of none. So some of the things I will be sort of looking at, maybe they would be things that you can particularly help your Christian people with, who you're ministering to, but maybe you can apply to everybody. Lots of people with mental health problems, they don't necessarily see what they're going through as illness. Often people see it as spiritual sickness, and would say that perhaps spirituality is the main problem, and feel quite fearful about talking about anything to do with God or religion to psychiatrists, for fear that everything's going to be put down to their mental illness. And I think that, or to mental illness in the first place. And I think that with COVID-19, there are lots of big existential questions around at the moment, which maybe we can provide a space for people to talk about, for people to air. So just to think about how faith can function in our lives, and to preface all of this is to say that I know that any sort of ministry at the moment is really challenging. Any sort of contact and communication, it's all changed, hasn't it, with COVID? And I suppose you can bring some of that into your questions later on as to how we actually practically have contact and communication with people. But just coming on to that question about how faith helps and whether it does help, the science says that faith can function, or religion can function, in different ways in a person's life, and something called intrinsic faith, where it's truly a truly held belief from the inside and then flows out into the rest of your life, actually, which we would say, you know, true Christian faith is, that really helps a person. Tens of thousands of studies have shown that faith can really help maintain well-being, help people recover if they've been in a depressed place, and the recovery is better, protects against suicide, helps with relationships, with forgiveness, and just so much more. There was another one there, but just generally it helps with mental health, just with a higher sense of well-being. So there might be a question as to how does it help? That's what the psychologists look at. They suggest that perhaps it's to do with community, and of course that's a concern at the moment, because people's communities have sort of broken down a bit, so they're different. It's been wonderful that we've been able to do so much stuff online, but I'm very aware that there are lots of people who are excluded from online activities, and particularly the elderly, and particularly people with mental health problems. Certainly lots of my patients, I can see that they're less likely, particularly the ones with longer term mental health problems, less likely to be able to have access to the internet. Just the cost issue is there. So we've got to be mindful of that. Religion, faith, Christianity specifically, gives a sense of purpose in life and meaning. Maybe there's something there about putting Covid-19 into some sort of framework as to perhaps being able to understand what's going on, and again gives us a means of perhaps coming back from feelings of guilt, of things that have gone wrong in the past, a way of being able to be restored. I said that mental health, faith can function in different ways. I suppose our role is to nurture that which is positive, not to falsify what, things, truth. Freud said that reality is the way to mental health, but actually sometimes religion can function in a negative way, where the only way in which it's functioning is to do with a set of code of conduct, and people just generally are feeling guilty about not being good enough. So often there needs to be a place where that can perhaps be challenged or explored. That idea of exploration is maybe one of the key ways, I think, in which we can support people with mental health regarding faith and spirituality. And the image of God, our image of God, is really, really important. So at the heart of how we think about God, it's very much connected with how we think about ourselves, our sense of self. And the science shows that people are intrinsically theistic, whether they like it or not. And we have an image of God that's built up from childhood, from our primary caregivers. That's called the intrapsychic image of God. It's like inside our heads. And then there's what we would say as people of faith, actually extrapsychic, the real God. And sometimes the two need to do battle, and it becomes quite complicated. And I think that perhaps particularly at this time of pandemic and crisis, or particularly at times of crisis anyway, these two images of God can be doing some battle. And what people often need is a space just to express that. And maybe we can do that for people. We can create that space where they can ask questions, where they can doubt, where they can say, I'm seeing God perhaps in a wrathful way. He's cross with us all. Or I can't see that God is big enough. It feels as if he's powerless. I can't see how any of this can help. So I was really struck by what Martin said about finding a voice. Maybe we can provide a platform where people can express these things, not necessarily needing to rush to any sort of conclusion, hearing what people say, maybe balancing with what people say, maybe offering a different narrative, but maybe then people will come to a place of resolution. It's a bit like the image that's used is Jacob wrestling with God. If anyone wants to read any more about that sort of idea, I don't know if you can see that, there's a book called The Birth of the Living God. It's a psychology book by Anna Maria Rizzuto, and she writes about this idea of our inner God, our inner concept of God, doing battle with the religiously received, the real God, and how it needs to happen. So there you go. I'll just leave you there because I'm sure that I've gone over time. But faith being a resource to nurture that which is positive and to provide a space for people to express doubts and questions, in a safe place.
Thank you very much indeed, Ruth. And Ruth, thank you for carrying on then. It must have been very off-putting for you, seeing that you were freezing, but we could hear your voice clearly. So thank you for persevering, and thank you to everyone as well. We're going to take a 5-minute break now, and my computer's telling me it's 18:03. Suzanne had a computer issue, but she's now back. So when we come back in 8 minutes, at 18:08, in 5 minutes time, we're going to hear from Suzanne from the local authority point of view. So thank you very much. Have a nice 5 minutes break.
Issues, and also supported living, and we also support the homeless as well. The public health is led by the council, so you will see lots of issues around COVID and health and well-being, and our public health department in the council runs the service. So you'll continually hear little snippets of what goes on in the council around our public health. I'm going to talk to you a bit about the effects of the pandemic on the residents, on the local residents of Medway, and what happened really. What we've seen so far is that there's been evidence of young people's mental health is really suffering. In particular, since some of the restrictions have been lifted, we've seen a high increase of young people being looked after and coming into the council for support. We've also seen a lot of socially isolated older people and young moms as well. So we've seen an increase in the number of people who felt socially isolated. We've seen an increase in domestic violence as well. As you can imagine, because of the restrictions, people in their homes spending much more time together than they usually would. And we've seen a high amount of people who've been sectioned onto the Mental Health Act. So that's people who have serious mental health issues, and we've seen the numbers increase over the last 2 months in particular, and we've therefore seen a number of the psychiatric beds being overused at the moment, just because people have felt very unwell. There's been many people who've stayed very well in the community for many years, and we've seen an increase in those people coming back into mental health services. And much of that is due to the lockdown and the restrictions and the isolation. There's been an impact on people on all age life stages. So what we've seen is pregnant mothers anxious about the birth of their babies. They're worried about finances, and they're socially isolated. We've seen in the 0 to 5 age group that there's been a change in their routine Some of those children have been socially isolated because they're not being able to meet with their friends, and it's also the stress of the parents has been impacted on the child. We've seen school years, boredom, anxiety, depression. In working age adults, we've seen balancing work at home, being out of work, carer stress, anxiety, financial worries. And then in older people, what we've seen is isolation and disruption to their normal routine. We've seen anxiety about being dependent on services, financial worries, fear about COVID, and the lack of family involvement. So what you've seen there is a whole different profile of the population than we previously saw pre-COVID. So I just wanted to say a little bit about what we have done since COVID. And there's been a lot of work done locally. There's been a lot of services set up. There's been lots of volunteers who've supported the council, who've gone out and checked on people, knocked on their door and stood back from the door, just checking you're okay. Do you need any food? Do you need a prescription collected? We've also seen some real kindness from our own workforce as well. So they've worked long hours supporting people coming out of hospital when they are in hospital and bringing them home. We've seen the voluntary sector who've been absolutely outstanding in supporting us. What we've seen is a general kindness across the system that we've never actually experienced before. I haven't, and it's funny, isn't it? All of my staff and myself, we've not had a break. My first break will be next week, and I've not had holidays since Christmas. And we've worked right through Christmas, Easter, right through, long hours, some days 20 hours, because we were just so worried about people. But as a community, I felt we all stood up. So it wasn't just the council staff, it was all people getting together and working together and supporting us. I often remember going to bed at night worrying about some older people, worried about the cold, worried about the fact that maybe that we'd missed somebody, that somebody we weren't aware about and nobody had told us and the family couldn't visit. So there was real stress in the system, but there was also an absolute sense of we can do this. We're a kind people across the system, and that's been my biggest experience of maybe understanding some of the issues and the mental health issues in particular, but being able to support as well. Now where we are now is we've stood up all the services are back now. They're different. We've seen a real surge of activity for people with mental health needs in particular. We're talking about increasing and developing the services as well. The next stage, of course, we're anxious about because we don't know for sure whether there will be a second wave, and there's a level of anxiety in the population about that. And also we're worried about what the winter will look like and the effect that will have on people with mental health problems. So what we're doing now is that we're working really closely together with the voluntary sector and with the statutory sector in the NHS to make sure that we're as best prepared as we can be for the next part of the journey. But I think there's a guarantee that the next part of the journey will be difficult, and we've got to make sure that we're kind and we look after each other as well. And as a system, we stand up and support each other. Thank you. You're on mute.
Thank you very much indeed, Suzanne. And I can say that I've been working quite closely with your teams, with the churches, who've been absolutely magnificent in delivering a lot of that care and support right across the board. So thank you. Our next speaker is Nicole Griffiths, and poor Nicole, she is from Mid Kent Mind. She's the main trainer there. She has had a migraine all day and is unable to join us. So I'm going to take this opportunity to tell you about two things that we've been doing with them, which you can all get alongside if you would like to. In September of 2019, the Community Engagement Social Action team that I run, went into partnership with Mid-Kent Mind in order to run suicide prevention training, and nearly 500 of you have taken part in that. It was all free. And Nicole and her team led those sessions. And what we did in that was to gather in an awful lot of people, not just from our church community, but also from the community at large. And those people are really keen now to use their skills to support us when we open our community cafes and our places of welcome and our chatties and all of our community hubs, which are so vital to the way forward to enable the agencies and ourselves to support our communities. So we've now continued that partnership, and I'm pleased to say now that Laura and Mind in Bexley have come into the partnership with us to deliver the mental health first aid course. Now, there are some huge benefits for some of you, or if not all of you, and your volunteers to do this. The course qualifies you as a mental health first aider, so this is hugely beneficial to your community. I'm just reading now from the notes about this. It will give you an understanding of mental health and the factors that can affect well-being. It will give you the practical skills to spot the triggers and signs of mental health issues. It will give us all confidence to step in and reassure and support someone who's in distress. And I think in our discussion section in a minute, Bishop Simon's going to lead us talking about that. It will give you enhanced interpersonal skills such as non-judgmental listening. It will give you knowledge to help someone recover their mental health by guiding them to further support. So that could be self-help resources, it could be through their employer, it could be through the NHS or their GP, or it could be a mixture. And the topics that will be covered on that are things like depression, anxiety, suicide, self-harm, eating disorders, psychosis, a real mixture. Now, Mid-Kent Mind have made a registration page already on their website, which is, you're going to get copious notes after this meeting and it will be there for you. But I do need to tell you that unlike the suicide prevention, this is a national certificate. There is a cost involved in this. So it's going to be £95 per person. I have to tell you, this is an amazing deal. If you go online and try and do it yourselves, it will be hugely more. That is what we've agreed with Mid-Kent Mind. And I would say to you that if you're working in a community cafe or a place of welcome, or you're working within your church setting, you will need to talk to them first about whether you can go ahead. And I'm very happy to do some fundraising for you. I'll sleep in my car, do whatever it takes. We're currently fundraising to get homes for our homeless people. We can do this. This is going to be so invaluable for our communities. But before you register, you do need to know who's going to be paying for this. It's a 2-day face-to-face course, and you might be thinking, what, face-to-face? But we are reopening, and we will do that in a socially distanced way. We will do that in a safe way. There will only be 16 people in each group, and that's not just for our safety, but it's also so that Nicole can help and support everyone to learn together. It will be a mixture of presentations, of discussions and workshops, so it's not the case of just sitting with a book. And in each session we'll be talking about the mental health first aid plan. So what I would say to you is, if you do the course, you will get obviously a certificate that you are now a mental health first aider. You have to complete the course to the standard. You will get an enormous manual, which will then be your reference point. You will get a quick reference card about your mental health first aid plan, which will be shared with your church and with your congregation. And you will have a workbook, which will have a toolkit which supports your own mental health. And the other thing is, and again, you'll have to talk very carefully with your church about this, you will be able to use the logo that you are a wellbeing cafe on your community cafes, on your places of welcome. And that means that members of the community, and also probably members of your own congregation, will come in seeking support. So this isn't just one of those logos that sometimes people use. It's sort of stuck on there to look good. This is something where People will be wanting and needing support. They will be heading towards you, and we have to be ready for that. So if you're going to do it, this is quite a big thing. It's a serious thing. We want to do it well, and we really want to make sure that the right people get to do that. So that will be all coming to you in your pack, and you'll be able to obviously talk to me about it at any time. Now, what we're going to do now is we're going to have a group discussion with all of our speakers who've been with us, and that's going to be led by Bishop Simon. So, Bishop Simon, it's really up to you how you manage this. Thank you very much.
Thanks, Caroline. I just want to say thank you also to Martin, Suzanne, Laura, Ruth, and Caroline herself at the last minute for everything that you said. There's such a lot of stuff there. The good news is it is being recorded, so I dare say as the recording is shared, you'll be able to pick up on exactly the bits that you want to pick up on, because it's hard to assimilate everything at once. But actually, this is a good moment, I think, to ask one or two questions of the panelists. And indeed, there may be other things that you want to ask, which you could put in the group chat. And if we've got time for them, we'll do that. But my opening question, I think, which is to the panel, and you can, whoever wants to answer it is fine. I'm not going to direct the question. How should we respond to someone with a mental health crisis? That's quite a helpful individual question to begin with. And there may even be the issue of, well, there are many different forms of mental illness, but there may be one or two generic signs that we could look out for too, so that we don't miss them. You know, whether that's anxiety, depression, panic, you know, whatever. So what are the signs, and also what are the kind of appropriate responses that we should make one-to-one faced with that?
I'm happy to answer the first question about you were saying about how we support people. So I think it's very simple. So I think one is kind of lower your tone, get into a calm voice. I would keep your speech really short. I think what you don't want is you're rambling and talking lots, because that's not going to make somebody feel at ease. So it's keeping it short, sweet, giving really small directions. So why don't you take a seat for a moment? Okay, I'll take a seat. If they're panicking, okay, I'll take a seat. Tell me what's going on. Wait for them to respond. Lots of us try and fill the silence, or we will talk over somebody. So it is just ensuring that you are giving them a space to talk. And that might seem silly, but actually we don't realise we often just talk over each other. So I would say be calm, be patient, allow them to speak, give them the time, reassure them that you've got time for them, and just say to them that this is going to pass. You know, this intense feeling right now, it feels really bad, and I know you're struggling, but it will pass. And, you know, I'll do what I can to support you and help you through that. So I think, you know, getting down on their level sometimes, you know, so if they're sitting, make sure you're sitting, and you're just trying to mirror their body language almost, and just, you know, open body language, and just letting them know you're there, really. I think that when people are in crisis and they're, you know, they think they're losing their minds, they think, you know, someone's having a panic attack, they think they're dying, and it's about reassuring to somebody, listen, you're safe, you're okay, you know, I'm here for you, and just going through the motions. Yeah.
Thank you. Very, very practical advice that you've offered there. And I guess also not to be afraid of the silences. As you said, I know, I'm reading between the lines, you're saying we just ramble on too much.
Yeah.
Do that now. But thank you. Any other observations from?
Yeah, I'd like to chip in, if I may. I think one of the most helpful things for people who are in that kind of position is to try and help them link the way that they're feeling to the reason that they're feeling it. Quite often there's an overriding sense of a loss of control. But generally speaking, mental health difficulties and illness don't happen for no reason. There is usually a reason for it, and sometimes trying to find that reason can be difficult, and even more distressing for people who just suddenly feel that life and their world has fallen apart. So some focus on what has changed, what can't you do now that you used to be able to do, talking about a benchmark position that they might have previously been in that is now changed, can help you down the pathway then to finding out, well, why is it that things have happened? Because quite often, although reasons can be obvious, they're not necessarily that obvious to the person concerned until they've spent some time thinking about it. And, you know, if you like, a degree of enlightenment as to the reasons for difficulty can in itself be very reassuring.
Thank you very much, Martin. Any other panelist observations on that question of how we respond to people with a mental health crisis?
Yeah, can I say something just about, again, sort of listening, you know, really carefully. I think there's a lot of healing in being listened to really carefully, but sometimes people might just sort of have a throwaway comment which we don't really take much notice of, but it might really be that they're saying that they're suicidal, or, you know, so it's listening out for red flag statements, even if they're just little side things, and not being afraid to explore that with somebody, to say, okay, what are you saying there, and what are you thinking? And obviously then, if we feel as if they're in immediate danger, then doing something about that. Sometimes that can be in an agreed way with the person about how they're going to be safe, but it might be that at some point we have to call the police. So it's listening out for the red flags, which I think particularly in the mental health awareness, but mental health first aid course, that's looked at very precisely.
Yeah, I would echo that.
Mm.
Thank you. So I'm not a panelist, but I'll chip in. I read a book earlier this year by a New York Times journalist called Kate Murphy, and the book's called You're Not Listening. It's, I think, still in hardback, but will be out in paperback in due course. And we read a lot of devotional stuff around the art of listening. I thought it was really interesting to get the perspective of a New Yorker on how we listen. And it really was a revelation for me. And I'd like to say it transformed the way I'm listening. I'm not entirely sure, because I probably just backslid again and I've become quite bad at it. But one of the things that really struck me was we spend most of our time in conversation thinking what we're going to say next. And we don't take our cue from the person who's talking to us. And that's how you get this thing where people just talk. You were saying, Laura, this talk over one another. And the surest way of curing that is actually to empty your brain of everything that you're thinking and take your cue from the person in front of you. It's like riding a wave as a surfer. It's quite challenging. And indeed, you do sometimes have to say things. It isn't just a case of listening to the other person. But actually, that's a really transformative thing. And for somebody like me, I'm a natural introvert. And so I've always thought, oh, I'm really good at listening because I'm an introvert. In fact, actually, it doesn't go with the territory at all. There's no connection whatsoever on that level. And introverts' brains can be full of what they're going to say next because they're naturally socially awkward and kind of thinking through the angles on it. So some interesting things there. And I just want to leave you with that book as a thought. And I will now shut up and do some more listening by asking another question of the panelists. $64 million question here, really. How can churches support and signpost people in need this way? How can we do that? And how can we liaise with you?
I'd like to have a go at answering that, or at least responding to it. I think it very much depends on where the church sees itself in terms of its position in a structure of mental health services. Mental health services often are described in a tiered way. Tier 1 is grassroots services like, for example, schools. Professionals like social workers, vicars, people like that are seen very much as tier 1 individuals and services. Tier 2 is the first level that you would access a formalized mental health service like adult mental health services, the mental health services run by the local authority, child and adolescent mental health services, but you would enter those at Tier 2, which is a community-based response. Tier 3 is then clinic-based, so an outpatient clinic usually, and then Tier 4 would be an inpatient admission. Tier 5 is a specialist inpatient admission, so maybe something like an eating disorder unit or forensic unit, something like that. So I think for me, the church would need to decide where it is that it pitches itself. And I think, you know, for me, it can only really pitch itself at Tier 1, which is the grassroots initial response level. But then it's also about how you link up with other agencies, other services, because you can't go it alone. You have to be a part of a structure that feeds then into the other levels as is required. There would be many people who would benefit from services at Tier 1 that could be provided by a church-based resource that may then never need to progress upwards to Tier 2 or 3 or 4. But it depends where you feel you fit in and what kind of resources that you have. I think in this day and age, there have been a lot of Tier 1 resources and a lot of Tier 2 resources that have been cut back. This is an ideal opportunity for the church to find a place, you know, in a increasingly sparse setup, but it has to be structured. It can't go it alone. It has to be a part of, you know, the other work that's being done. Otherwise, it becomes fragmented and unhelpful.
I agree with Martin. I think what Martin says is really correct around the tiers. For the council, and this is a real worry for the council because the demand is increasing at a rate much more than we expected. And I don't know that we're very good at the grassroots, and in particular the intergenerational stuff. You know, I think about the family. We've got so many young children now with mental health issues, as well as then, you know, teenagers going into adulthood. And then of course our working environment has changed quite a lot over the last 20 years, but even more so now over the last 2 or 3 months. And I think there's an opportunity for the church to be part of that journey and that change that we're going through, but making a real difference where people feel it's a real difference and it can influence and give practical support. But, you know, I'm obviously, you can see from my accent that I'm Irish, but I'm also a practicing Catholic, and I know that people don't always like that. And, you know, people in the services are generally quite nervous of that. So people keep their religion and their church separate. And I think there's a real anxiety in the community about what the church would do if it got its hands on you, as people would say to me. So I think that has to be called out and see what that feels like, because it's such an integral part of the development of our communities and making them resilient and robust, because that's where the grassroots work in Tier 1 happens, and 2.
I think I'd like to, I know I'm not a panellist, but I think I'd like to answer that from a community point of view. So I say to any of you who are doing community initiatives, we in general are not specialists in the field. But what we are brilliant at doing is making the right atmosphere for people who are at all levels of mental health issues or struggling with life in general. We're very good at putting on the kettle, having a lovely community feel. We're very good at including everybody. And I think for me, if we can make the right atmosphere in our community hub, then we should be inviting in the agencies that work with people in whatever the specialist field is. So for example, if you went to St Mary's Greenhithe or St Augustine's Gillingham or Living Well in Beckenham or any of the community hubs, you would see that the church is making the meals or the refreshments or the atmosphere, and the agencies are all in there doing their work. And that for me is where we can bring everything together. And that for me is everything about hubs, because even when we've done our mental health first aid certificates, we were scratching the surface of an enormous issue. But the agencies, they know their stuff, and quite often, and I know some of you will be cringing at this because I know the churches are going to be really short on money, but we just offer our buildings for free and in they come. But we're working alongside, because it's more than just them getting the support. They need community. And somebody's written in the chat about their homeless communities, it's Lorna, and struggling. And we work a lot with homeless people. We know that they need help integrating into the community. So whole person care is something that we know about, and we do it really well. So I would say, don't try to be an agency yourselves. Invite the agencies in. And I agree with what Suzanne said, but I have to say, when you go to an agency and say, how can we support you? What do you need? And then we support that. We don't just say, oh, well, off you go. The hall's free on a Friday at 3, in you go. We say, well, okay, we'll come along at 3. We're going to make a lovely cafe area. Your clients can meet you. They don't have to be identified as having this particular need. You might need a private room somewhere. We're going to do that. That is building community, which is when the church is back at the heart of the community, which is where we should be.
Thank you very much, Caroline. But there is one question in the chat that actually I'd just like to ask, and I think it may be Ruth, if it's okay. Sorry to put you on the spot, but as a mental health chaplain, you may have an observation about this. Peter says, although some churches are very good at signposting, others sadly actively discriminate against mental illness. How can the church change to overcome that? That's a huge question, but you may have one or two kind of snippets and observations to make about it.
I will do. Apologies, because I might be joined by my cat who's meowing behind me. I think that probably churches aren't deliberately being prejudiced against people with mental health. It's just that they're just not really aware. And one of the things that we've done as mental health care chaplains in the past is very much sort of go along to churches and talk about mental health awareness, and again about how we as churches are in a unique place for people. I would say there's something about one of the things that meeting people where they are, rather than expecting everybody to be fitting into this mold of a person who can come and sit through an hour and a half long service in a very formal sort of setting. There's variety in what we can offer. When there are services and when there is preaching that it's real and mental health problems and struggles are acknowledged, people are shown from the ministers for the priests that how to be. It's interesting. I have had experiences where I haven't been sort of the vicar in a church, but people have spoken of church rowing to the priest. There's something about we can give that message that we're open to people or we're closed. So yeah, inviting someone to come in and speak about mental health awareness and maybe having a variety of activities, which is difficult in COVID times, but yeah, that's what I would say.
Do you mind if I sort of chip in again? I was
certainly
struck by something Bishop Simon said right at the beginning of the seminar, which was about people talking more about mental health issues, about feelings, about emotions. And I think compared with how it might have been when I first started in the NHS, I think that's true. But the fear that I have is that this is perhaps a fashionable thing. You know, it's been promoted by some very well-known celebrities, including the royal family, which I think is helpful. But also, I think it can also distract from the very real issues that lie underneath it. And that almost always is to do with an ignorance of what mental health difficulties really can be, a fear of them, and a prejudice about them. It's within my working life that I can remember going into work and seeing groups of people standing by the gates of the psychiatric hospital that I worked in, waiting to see if they could spot a patient and have a laugh at them. And that's within my lifestyle. I'm probably quite an elderly person now, but nevertheless, it's within my lifetime that's happened. I don't think it happens so much now, but I think we should try and capitalize on the good things about talking more about feelings, but also be wary that it doesn't just become fashionable like some other things have become. We need to keep it going so that prejudices are continued to be dismantled, because without that, I have certainly found over the years that I've worked in mental health, they still exist. People are not always willing to be as open-minded as you might wish them to be. And therefore the ability, I remember working with Mind in Bexley some years ago with a colleague of Laura's on trying to develop a hub for mental health services. And we came up against just such a problem. So I think the message has to be let's capitalize, but also let's try and dismantle the fears and the prejudices that are still very much around. And I see that very much with children and young people as well.
Thank you very much, Martin. Got time for one more question, I think, Caroline. I'm looking at the nod of approval. Good. From Ed and Anne, who said to the panelists, you've talked about people who come to you and have recognised that they have a mental health issue. What do we do to help people who clearly have a mental health issue but haven't recognised it?
We get asked this a lot, and I think it's horrible because the answer is there's not much you can do. I think that if somebody doesn't know they've got a mental health problem or doesn't want to accept it yet, it's very hard for you to get them treatment, because they need to be active in their own treatment. They need to be present. They need to want to change. And if they don't want to change, then you can't drag them to a therapy session or make them take their medication. I think obviously if somebody was really at risk and at risk to harm themselves or others, then that's a different story. You'd call 999 or you're trying to get a mental health assessment at the doctors. But I think we get asked this a lot, and I think the answer is we don't have an answer. I don't know if anyone agrees with me, but I think it's very difficult to get somebody to make changes if they're not aware that they need to make a change.
Totally agree. I think the issue for us in services, in statutory services, is we can see that someone is mentally unwell, and the family can see it as well. And I can think of loads of cases where this has happened, where it's very obvious the person is unwell, but they've said, no, I'm not unwell, I am fine. But there's high levels of distress, and we know that they're very likely to, at some stage, get into risky behaviour, but not enough for them to be a danger to themselves or others. And sometimes you just have to wait. But it is so hard for families in particular, I think, when they know what's going to happen and they've seen it happen before as well. And that is really tough. And services cannot, they're involved, but they can't always help, because the individual doesn't want them involved. And sometimes we have to wait till there's an absolute crisis, and we have to get involved around a Mental Health Act assessment. And that is awful, because that's a terrible experience. It can be really traumatic for the individual and the family. But sometimes we have to wait and do that, and it frustrates me at no end, because that's what we have to do. And that's the way the law works as well, because previously to that, what we were doing, we were putting lots of people into mental health asylums. When I started nursing a long time ago, there were people in psychiatric institutions who had been pregnant out of marriage, and they ended up in a psychiatric unit for the rest of their life. Yeah. So there's a balancing act, and people have, we've got all sorts of acts to support people, but sometimes I just know that if we could intervene earlier and be more assertive and have more powers, that people would have better outcomes.
Yeah, and I think it's knowing that relationship, isn't it? Oh, sorry, Martin.
No. I was just going to say, I entirely agree with those comments. I think we are, to some extent, geared towards a more crisis-based response. But I think a lot of the reason for that is that a lot of services and agencies have been dismantled, as I was saying earlier, at Tier 1. I think if there are more supports available for people, the numbers of crisis-related cases does reduce. I think there's significant evidence to suggest that. But there just aren't the services there available for people to access at that level. So quite often their distress is going unaddressed until it reaches a point, whereas, you know, the point was made, it becomes, you know, possibly, you know, a very serious mental health act issue. So I think it is more about the structures that are available before somebody gets to that point that can prevent that deterioration from occurring.
Yeah.
Sorry, I interrupted you.
And Laura, did you want to say anything additional? Or
Oh, I was just saying, you know, the only thing you can do, it depends on how much of a good relationship you've got with that person. And I guess it's just trying to get them to make links. So something like, oh, okay, so when you drink, you're telling me that your mental health deteriorates, and you're telling me you then go and get into an argument with your wife, and then this happens and this happens, and then days and days after you feel really low. I wonder if we can look back, is drink an issue? And it's, you know, I always say that when I want to make a point, it's about saying, I wonder if this could be the reason, or, you know, and just trying to work back for them. But yeah, so I just say, you know, it does depend. Sometimes you can be quite assertive, like you were saying, and saying to them, you know, this is what you need, you know, this is something you need. But the same breath, you can't force them there. So we find it especially, like, exceptionally tough, just like you all do it, from your question.
Thank you. I think Ruth may just want to have, I know, Caroline, I think you'll want to chip in now, but Ruth, you can have the last word in the panelists.
Oh, well, two little things that you can, there is something called a forward directive. So for people who have already been ill, they can have a sort of agreement with actually with their loved ones, with their employers, it could be with their church, to say, these are the signs, these are the symptoms I display when I'm getting poorly. I'm giving you permission to point them out to me, because I might not be aware of them. But that's a forward directive, it's already there. But I was also thinking that if you've built up some trust with somebody and you've listened to what they're experiencing, that often there is a time when you can reflect back to them and even use a little bit of psychoeducation, saying, well, sometimes people who are feeling that it's because of such and such, or sometimes it's because of such and such, and you let people perhaps join up the dots themselves, and again sort of start to question themselves about their own health. Yeah.
Thank you very much. I think at this point, because time's moving on and we do want to finish by 7, I want to thank the panelists for contributing on the hoof and so well tonight. And just hand over to Caroline for next steps before I wind it up at the end. Thank you.
Thank you very much. I wish we could go on with that discussion. I just got a couple of things to tell you about, which could be next steps for you. The recovery course has gone online. Quite a number of churches are part of the recovery. This is about addictions, and obviously addictions severely affect mental health, as Laura was just alluding to. It's going to be a national online course. It's starting on Thursday, September the 17th at 7 o'clock, and it's going to be weekly with a talk, a testimony, single sex groups for discussion. And really it's about helping recovery. It's for people who might be new to recovery. It's for people who might be in solid recovery or still working towards recovery. So if you know of anybody, I will include that in your notes with the link. It's starting on the 17th of September. Corin Pilling, who is the director from Sanctuary UK, he is here tonight. He's going to be coming to our monthly community Zoom. Those of you that work in community, you know we have a Zoom once a month. Our next one is the 15th of September. He's going to be talking about the link to Sanctuary's burnout response for community workers and leaders, and also their COVID and grief resource. He's going to be speaking into that. Some of you, because of booking in for this, have been letting me know about some of the things that you already do at your churches, and I'm very keen to hear more about that. Dave Johnson at Christ Church Chislehurst has linked up with I'm probably going to say this incorrectly, and I'm sorry if I do. Kintsugi Hope. 4 of his team have been trained and they're running well-being groups now. If anyone wants to know more about that, I'll put his email in the link. We're very keen to hear from any of you who are professionals and who are working in the field of mental health. From your booking in for this conference, we've picked up Joseph O'Neill Byrne, who's a community psychiatric nurse and lecturer for 48 years. He's based at one of our churches. So if any of you are sitting there thinking, oh, I wish I was on that think tank, please do let me know, and let me know what you do. And again, as we said before, if any of you have been affected by anything that you've heard tonight and you feel that you want to go and talk to somebody, do look at the email that I sent you. There are all sorts of crisis support links there, people who will be willing to talk this evening. There's the Shout Helpline, there's the Kenton Medway Safe Havens, the Samaritans, the Suicide Prevention Programme, all sorts of links. I think there was about 17 different agencies there. So please do, just remember that no matter how difficult things are, you are never, never alone. So do reach out to somebody. Thank you. And also, I just want to say thank you so much. We have had a few technical issues going on, which I don't know how well we hid them, probably not very. So thank you so much for bearing with us with that tonight.
Thank you, Caroline. So I want to say thank you to Martin, Suzanne, Laura, Ruth and Caroline for the contributions they've made tonight. So much wisdom there amongst them, real professional expertise. But you will have also picked up listening to them that they haven't done the extra mile over the last few months. They've done the extra marathon for the people around them, and really want to pay tribute to them and thank them as part of the wider community for what they've clearly achieved, but probably not entirely being thanked for because not everybody has known it. So thank you so much for that. Just want to say in finishing 1 or 2 things to people in churches in this diocese and beyond. Let's create environments in which people can have the confidence to express themselves. That's come across tonight. We should each speak openly about difficult issues and help people to address the wider culture of anxiety that exists. So it calls for a bit of self-sacrifice in our own honesty about stuff. It can be quite difficult, but I do think that as leaders within the church, we have that obligation to express that degree of personal vulnerability in a safe place where we're sure that we'll be received. You'll have seen the Children's Society report that came out last week, which said a number of things about the mental health of children and young people. And one thing in particular it said was young people are growing increasingly afraid of failure. That's becoming endemic in society. Some of you may be like me going on to another webinar shortly, led by Theos think tank, at which the American philosopher Michael Sandel is going to talk about his new book, The Culture of Winners and Losers in Western Society. That kind of talk we have to excise. We have to get out of our churches. Yes, there is a concept of strength and weakness, and I think as people we are alternately strong and weak. And we support one another as to where we're on that continuum. But we need to get rid of the talk of winners and losers in society because it's a very bad one. And I have to say, it's coming right from the top in a number of cases in the tweets that we see. Children and young people are themselves soon going to be adults. And it is a generation that's seen a spike in mental health issues. So this question is not going to go away. And because many mental health questions are quite intractable, they're only going to grow, and I do believe that it's part of our shared ministry working alongside these agencies tonight to help young people as they mature to deal with the issues they inherited very young. We believe in a gospel of peace, and we want people to discover this in an environment where you can confess faith in Christ and still feel able to say, right now, I'm not okay. If we get to that place, we'll have achieved something. I want to close, if I may, tonight with a prayer. If you'd just like to join with me or not, it's entirely up to you, but I'm going to close the event with a prayer. So let's have a moment of quietness and silence. God of the light and darkness, We pray for those whose minds right now are locked in a living nightmare of pain and despair, for those whose condition puts them at risk, but who are not understood by others, for those who are drowning in a sea of destructive inner voices. You are a God who speaks words of calm to the chaotic waves that threaten to engulf the vulnerable. Be the comfort and the consolation of all whose minds are ravaged. By your grace, may they find the help they need and the warm perseverance of those around them. Thank you for all agencies working in this field, especially those here tonight. May they have the wisdom and the resources they need to express the care they feel. And may your church create new spaces where people speak openly about their minds and that they're listened to with kindliness and generosity, and where your Son Jesus may do his unique work of peace in the lives of those he came to redeem. We ask this for his name's sake. Amen.